Nathan is my beautiful baby boy. He was born at 24 weeks. He was in the NICU for 4.5 months before coming home. And since then, he's been an absolute joy to us. And we just are thankful every day to have Nathan in our lives. Nathan is a survivor. He's a miracle. At first, the pregnancy was going along normally. There was no complications. And then at 15 weeks, all of a sudden, my water broke.
I remember the doctors telling us that that she has no amniotic fluid in. And I didn't quite understand what that meant. I knew it wasn't a good sign, but once he talked about the grim prognosis, it put us back to reality.
The doctor looked at me and said, there's very little chance for this baby to survive. Bottom line, I was told that I had about a 10% chance or less of having a surviving baby, and even if the baby did survive, he would be at significant risk of brain damage or other serious complications, and that it was a fairly hopeless situation. I was given the option of terminating the pregnancy and was told that that would be a very reasonable decision if I decided to do that. But at that point, I could feel the baby moving inside me. I knew that he was there and I was already connected to him, and there was just no way that I could make that decision to end the pregnancy.
Any parent to make that decision it's probably the hardest thing. We felt the ground drop. We felt that we were about to lose him.
I went on bed rest, I drank a lot of fluids, and did whatever I could do to try to make sure I didn't kind of rock the boat and end up going into labor. So I just held on, and miraculously the pregnancy continued.
When she was 23 weeks with Nathan, she got admitted into a hospital.
I knew that 24 weeks was the kind of cutoff point for viability based on just general medical knowledge. So I knew that that was kind of my baseline. 24 weeks is what I needed to get to.
We tried to stay strong. We were hoping for the best because we had no control over what's going to happen.
As I was going down to the delivery room, it was 24 weeks and 4 days, and I'm thinking, there is no chance.
I remember walking up there and hearing his history and just being very nervous about it. I went up there with Dr. Eig, and he just kind of looked at me and was like, we're going to do everything we can, and it's going to be the best we can do.
Even when I was on the delivery table, the neonatologist came over to me and said, we're not very optimistic about this.
It was out of my hands, left up to fate. Then you came, 1 pound light, your frame so small. 16 weeks early.
I remember them pulling him out, then weighing him, and he was 1 pound 2 ounces. And just hearing that number was rewarding. We did have a little hope that he's going to pull through this.
They were working on him, and I was just looking over to see what was going on, and next thing I knew, they were wheeling him out to go to the NICU, and the doctor came back over to me and said it was a little better than expected. We're going to take him down, we're going to put him on a ventilator and see if we can get his oxygen levels up, and he's in good hands.
Hi, sweetie. Hi, baby.
That's your mommy.
Babies are tough. They're really tough. Born at 520 grams in 24 weeks is a challenge. And he had many, many problems through his preterm life in the NICU, but the good thing about Nathan is he was able to pull together, and he's doing very well, survived.
He has a blood pressure that we measure centrally right here through this little PAL. But
in the beginning, it was kind of touch and go. He had a collapsed lung the first night. He had very low oxygen levels, so they weren't even sure if he was going to make it through the first couple of days, but then he pulled through. Then a week after he was born, we got a call about midnight, and we were told that he had a bowel perforation.
I went to do my first care with him, give my first assessment of my shift, and I noticed a small dusky or blue spot on his belly. We call it NEC in the NICU, necrotizing enterocolitis. It can be an infection in the intestines that can be very deadly, especially in our babies as small as Nathan.
We were incredibly worried. The chances of him surviving was about 40%. Around that time, we haven't had the chance to even hold him. So it was incredibly painful.
The bowel in these preterm infants does have a propensity to develop what's called spontaneous perforations, and it's just a weak point. And he did have a perforation that was taken care of appropriately. Drains are placed, and then at a particular time, either we remove the drains and see if the holes heal, or sometimes they definitely need surgery.
They allowed us to hold him before they performed the surgery, and we just cherished that moment. Because we didn't know we were going to have a moment like this again. I remember sticking my finger in his eye slit and holding his tiny hands, and his hands were just big enough to hold the tip of my finger. And just him grasping my finger was an incredible feeling.
The doctors were very cautious. They were guarded. They weren't sure whether or not he was going to make it. And a couple days after that happened, one of the doctors said to us, he's acting septic. And that means, an infection that has spread to his bloodstream, and that's extremely serious. And so when I heard that, I just, all of my hope, it just crashed and my heart sank. And I ran out and I was in tears, and we rushed to the hospital. And when we got there, luckily the nurse said, it wasn't as bad as we thought, that he was holding on, he was stable. And so he gradually progressed from that. About 2 months after he went into the NICU, he got off the ventilator. And so he was finally breathing on his own and doing well. And at that point, we thought, he's probably going to come home. But then another challenge came up.
One of the last organ systems to mature are the eyes. And the problem is that the eyes feel all of the stress that is placed on the baby, all the changes in oxygenation, changes in blood pressure, changes in nutrition, and they are affected by that since they haven't developed yet. The eyes can develop some significant problems, of which his did.
At one point, the doctors told us that he had a very good chance of going blind. They decided to try this kind of more experimental drug. It's called Avastin, and it was something that they'd only been using for about a year at that point.
We're very, very fortunate to have excellent ophthalmologists that look at these babies at a very methodical particular time. And as soon as they begin to notice that there's abnormality in the blood vessel migration, then they start working on treatment. And the key to this is to catch it early and then to be aggressive with your treatment, of which fortunately Nathan experienced.
He's been able to retain his vision. He's actually has retained it to such an extent that they don't even expect him to need glasses.
The day when he was coming home, we could finally celebrate him. We could finally be there and take him home and be like normal parents. And it was truly an amazing feeling. It's always a happy day. And in fact, you always sort of know one of our long-term babies leaves because it's just this great atmosphere.
It was May 29th. We went and picked him up, and we had the perfect outfit for him. We dressed him up in a cute little outfit for him to come home.
His blue jeans. That's what I remember the most, just his blue jeans. A baby who starts out so small, who ends up leaving 8-9 pounds later, eating like a champ, doing great, and just ready to roll home with his family, something that you never thought was going to happen. It just shows me that what I'm doing is what I'm supposed to be doing, and that there's always hope in the darkest of situations, that these babies can overcome everything and just thrive. And we just have to keep fighting for them.
When we were riding in the car coming home, I just thought to myself, I can't believe it. I was able to take him home, I was able to care for him, I was able to do something, and I was able to be there for him, I was able to be a parent. So it was just a miraculous, uplifting, very happy day. There were definitely a few big lessons that came out of this. The first is to really appreciate every moment. When you have a baby in the NICU, every little thing is a major milestone, and so you don't take things for granted. Nathan was such a miracle. I mean, he was not expected to survive, and but he did, and he came through incredible odds to get to where he is now. And one thing that struck me while he was going through that experience is that the only reason he had a chance to survive is because of where he was born and because of the facility that he was born in. And it struck me that there's so many parents out there who have babies in locations that where they don't have those kinds of facilities, or they're in developing countries and don't have access to adequate health care. And so what I want to do is use Nathan's story to be an inspiration and to show that survival, and not just surviving but thriving, is possible for preemies.
I grew up in India, and one thing I feel confident about is if you were in the same situation and if we were back in India, we probably wouldn't get the same kind of treatment that Nathan got. One way to remedy that is to channelize resources that we have over here, the knowledge that we have over here, and pass it on to areas that don't necessarily have the right amount of resource.
It's a Pebbles of Hope Foundation, and we call it Pebbles of Hope because pebbles are tiny, but they're also very strong. We're hopeful that with our programs and interventions that we can make a difference in the lives of premature babies and give them a greater chance of survival.
A tiny reflection made of gold.
Nathan is doing amazing. He's on target as far as his adjusted age, as far as all of his gross motor skills and fine motor skills, and he's doing everything that a typical baby his age should do. He's babbling, he's communicative, he's social. I never thought that he would make it to this point. Now that he is at that point, it's just so amazing to be able to relax and to be able to just enjoy him without worrying about the future or, worrying about his survival, I mean, we can just enjoy being with him.
He's such a joy. We cherish every moment we have with him right now. I can only see it as a miracle. I can't see it as anything else.
A